Next, we're going to work on pain. Now, pain comes, if you'll think about it, pain comes from a lack of oxygen. Almost every time you think about pain, except somebody cuts their arm off or gets a deep cut, an accident, broken bones, but the pain actually comes from swelling of that area and squeezing tissues and anoxia. So even with a broken arm, you can lessen the pain by using cold packs or ice packs. So it decreases the swelling. We'll talk about burns in a few minutes too, but to start with, I want you just to think about cold is something that we can use to balance circulation. At first, when you use something cold, it constricts the blood circulation, so it closes down the blood vessels. But after 2 or 3 minutes, after you're icing something, you'll notice that the skin starts getting red, so it dilates the blood vessel. And when you dilate, you actually increase the amount of circulation by 5-6 times, not just percent. That's a lot. 500%, 600% more flow to the area. So we use some of these ice massage and things to get rid of muscle soreness from over-exercise, from like somebody's been sprinting or running and they haven't run in a long time, they have shin splints. It works on that too. There's lots of different situations that you can use ice for. I had pulled a hamstring muscle years ago, and so after about 2 months of letting it heal, I said, I really should give my ice massage a go. And I needed to let it heal some anyway, because you torn tissues, but it had a big knot there in my backside of my leg. So I, sitting in the morning, again, reading my Bible, and I said, let me get the ice cubes out, and I saw my ice cup. So what I do is I just keep a couple plastic cups in the freezer all the time, in case one of my boys get injured, or my wife or myself, so we can treat ourselves. So when you fill these cups up, don't fill it all the way to the top. Water expands when it freezes, and it'll break the cups. Do not use glass. Just be sure you use some kind of plastic cup. Even a regular plastic cup's a little thicker, like a Tupperware or something. It's got enough stretch to it that it won't break it. Styrofoam cups will tear it, but it won't hurt anything. It usually will, after it's frozen partly, it'll expand and break the cup, but it's already frozen on the outside, so it doesn't spill all over the refrigerator or the freezer. So it takes a couple minutes of being out of the freezer, so it'll pop out. We've had ours out for a couple minutes, so it's already came out nicely. Otherwise, I put my hands around the cup and it'll warm it up just enough. It only takes maybe 30 to 60 seconds to come out. Then I'll wrap it with a little towel, a little hand cloth. If you're going to be doing a neck, I'd recommend that you use a bigger towel so that you're catching the water as it's dripping, so that the patient's not going ooh, and screaming because the ice is going down his stomach. The ice water is going down his stomach. It'll feel good, but it's a little unnerving for somebody. They're not used to it. So
that's a good way to wake up.
Yeah, it is. Let's just say somebody has a tennis elbow. These muscles right in through here. Somebody's been working on your arm. Yeah, well, come on up here. Let's work on my wife here.
It's been hurting me for about a week now.
Yeah. So every time she leans her arm against something, it aches. And I found the muscle, and we're doing some cross friction rubbing on it. So come around the other side here. So you're on the proper side, and there we go. And so just put your arm out straight. Now, this muscle is an extensor muscle, okay? So that's one that extends your wrist, and it also could be one of the ones that extends your fingers. So I'm not sure what she would have done that would have aggravated, but some activity that she was doing that would have made it get sore. So in order to do ice massage, it's best if you can stretch the muscle. So to do just the exact opposite of what that muscle does, it pulls up and straightens your fingers. So if she can flex her fingers and bend her wrist, that's stretching it as long as it'll get. And then I'm going to start massaging it here. And if I could use one of your other...
Wrap your ice up and if you're not going to use it right now, keep it so it's not frozen.
What is it?
If you're not, do you want them
That's
to use
okay.
their ice right
Yeah,
now?
go ahead. You can practice on yourself where...
I dropped a liter water bottle on my foot
Oh,
a few weeks ago, and it feels like a bone bruise.
yeah. Yeah, that could help, definitely. So I'm rubbing this directly on the skin. I don't have it insulated. It's actually, now you can see even in just less than 2 minutes how red that's gotten. Okay.
See how red it is?
Now we're gonna make it red. But and one other thing you can do is use the edge of the ice. Same kind of thing. It's got a soft, smooth edge, and then I'm stretching the tissues, the soft tissue
Easy
massage.
to do it on herself like that?
I just got knots here.
Yeah, if you got knots in your neck, your trapezius, those are the most common places people have aches and pains.
Don't
Are
do it
in.
around by your carotid artery.
Yeah, I'm gonna talk about the carotid artery in just a minute, right in the front here.
Huh?
So don't do the ice there, except the way I'm going to show you in a few minutes.
Brenda, you're supposed to stretch it at the same time.
Yeah, like
Stretch
that.
the
That's
muscle.
good.
Put the muscle
Tip your
on a
head to the
stretch.
side
Yeah.
and stretch it.
Yeah.
Good.
Stretching yours, Maxine, yeah.
So back to my hamstring pull, what I did is I got in my underwear and I'm sitting in a chair, leaning forward.
Did it for 2 minutes. So tell them.
Yeah, so hang on a second. So I'm leaning forward and I'm massaging that muscle with my knees straight. To get a hamstring stretch, you want your knees straight and your body flexed, and that tightens the hamstring. And then I did the ice massage. Now, when you're doing this, do it 2 minutes to one area and then quit for 2 minutes. That allows the blood vessels to dilate, and your skin is kind of numbed also from the ice. But if you keep going continually, the patient's going to say, you know, that's really burning. Could you quit? And I say, well, we need to do it. You know, it's good for you. And they say, no, quit. I don't like that. So if you'll stop at about 2 minutes, let it dilate, it starts warming up on its own, and then it's pretty numb. When you put the ice back on it, they hardly even feel it.
And then
So
you do it for 20 minutes.
Then you do it for finish the 20 minutes. So you do 15 to 18 more minutes.
Wait 2 minutes without
And
doing
then-
it, then do it for 20 minutes.
Yeah, then you finish for 18 more minutes.
Okay, 18.
Yeah, so you have a total of 20 minutes. So we want her wrist bent and her fingers tucked, and then we're icing.
So I can do it myself.
Okay? So you go ahead and keep working on that now.
Okay, so I'll do it.
All right.
So
Thank you.
after 2 minutes, it'll go numb.
It's already cooled off enough that it's somewhat numbed anyway. What you feel with hot and cold treatment is the contrast of the temperature of the skin and whatever you're putting on
2
it.
minutes, is that it?
So,
Just one. Let me bring this up. Okay, go ahead.
good. So when you first, like I had somebody the other day, we were doing an ice massage. She's very ticklish, very sensitive, and so I had to start with the ice. She had back pain, so I started with one small little area on her back, and she screamed. And then I got it a little bigger area and a little bigger area, but she finally got used to that. Then if I touch anywhere that I hadn't been already, she'd woo again, you know, she'd squeal. But after a while I said, can you feel that? I can feel, yeah, she's fine. So it numbed the area so that it wasn't hurting and it wasn't sensitive anymore. So rarely do you find somebody that sensitive. I mean, she about came through the ceiling the first time I touched the ice to her. So again, so we're doing the 2 minutes, wait 2 minutes, or you can go to a different area maybe you have both shoulders are sore, trapezius on both sides, and you go back and forth, you could do that 2 minutes here, 2 minutes here, 2 minutes here, 2 minutes here, back and forth for 20 minutes. That still would give you a good effect. So, all right. So those are some things you can do with the ice. Now, what other kind of things do we do with cold?
Sprains and strains.
Yeah, if sprains. If you sprain your ankle, you get a swelling. To prevent the swelling, you put cold pack around it. If you have a back injury, you put a cold pack on your back. The sooner you do it, the better. I've been lifting patients and helping them stand up, and I feel something in my back, and then I know it's going to be a problem for 4 or 5 days. So I'll get a cold pack while I'm doing some charting or something, and I'll put it on my back for half an hour. Then go get another cold pack, and sometimes you just slip it in your pants and put an ace wrap around you, or tuck your shirt in tight. Anything that you can keep it cold for even an hour is good. If you don't have ice, you're up a creek without a paddle. You've got to have ice to do this. You just have to. Cold water is helpful. I mean, it's okay, but it doesn't do as much. Now, yes.
That was to run over to the place and buy a water bottle out of the refrigerator. That would be best if that's all you have.
That'd be good. It's cold water. A lot of people will take a water bottle and freeze that, and then the water doesn't get all over the place when it melts. It's not as effective, but it's close. So you can just rub the water bottle right on your skin, or you can rub it. That one's particularly helpful for plantar fasciitis, for the foot. You take your sock off and you just rub your foot over the bottle, the cold water bottle, and that massages it at the same time it's getting the ice treatment. So that's really helpful. Okay, now one other thing that's a lot of people have trouble with is burns. And nowadays they're discouraging using ice for burns. And it's unfortunate. They say, oh, well, you're going to get frostbite. You're not going to get frostbite from a bag of ice with a double plastic bag, and you have it in a pillowcase. It's insulated enough so that you've got protection from that ice. It's not too cold.
And this isn't going to give me frostbite after
20 minutes isn't going to give you frostbite. Yeah. Yeah, you're moving it, you're massaging it, you're changing the circulation, you're moving it around. So, no, the ice is massaging it, it's getting new blood, new oxygen. But at the same time, when you cool something, you're decreasing the metabolism of the tissues, decreasing the amount of oxygen that the tissues need anyway. So it's really helpful. And I'm going to explain about burns. What happens in a burn, let's say you had an explosion of gas or some kind of boiling water spilt on your hand, or one time I grabbed my wife's curling iron to put it away when we were packing up, and I didn't know it was hot. And I grabbed the wrong end of it, and it was just, so I had a burn right across here and right across here. So I went and got some ice cubes, put it in a plastic bag, and we were going to be taking a hike with the whole group, so I just put my hand on the plastic, on the ice cubes with the plastic bag and a t-shirt or something. And then I took an ace wrap and wrapped it around it, and I just went for a walk. We came back 45 minutes later, and I took it off, and it looked a little bit better. It actually had turned white immediately there across my hand and across here. That's not good. That second degree? It would have been a third degree, I'm pretty sure, because it was probably 200, 300 degrees probably. I don't know how much those little curling irons get up to, but it's too hot. It's probably 200 degrees, maybe not that hot, maybe. But anyway, it's hot enough to burn your skin. And so I came back, and it was red there. It was pink, and it still hurt a little bit. The key to having a burn is when you take the ice off and it returns to room temperature after 15 minutes, there is no more pain. If it still hurts and feels like it's burning, then it's not long enough. You put the cold back on it, wrap it back up, and leave it another half an hour, 45 minutes, an hour. Test it again. Take it off. This time, it still hurts a little bit. Maybe add another 20 minutes. Wrap it up. Take it off again. 15 minutes. Wait 15 minutes. Oh, now it doesn't hurt. That has helped to lessen the swelling. It's helped to decrease the metabolism of the tissue so it doesn't need a lot of oxygen, and it's also numbed the area some, and it's restored better circulation to the tissue so that it doesn't go into a deeper burn. If you'll think of 6 or 7 layers of skin, you burn the top surface, the surface is ruined, that's probably going to peel, probably, like a mild second degree burn, like a sunburn. But if you leave it without treating it and only put some antibiotic cream on it and wrap it up like you would do if you went to the hospital, they would just wrap you up, and then it starts to blister, it starts to swell down below, and the other layers of tissue start swelling. That's when the blood vessels get pinched off. The blood vessels can't supply oxygen to the tissues anymore, so all that tissue below dies also. So you get it dark in within 5-6 days. It's all dark tissue there, and that has to be debrided, and it'll take 2 months or 3 months for that to heal. If you had put the cold on it for 2 hours to 4 hours, that tissue damage wouldn't happen underneath, so it'd be minimized to just simply, it's going to peel the first layer of skin off. And in my hand, your hand's very thick, your skin there, it never even peeled.
Wow.
And you can also use aloe vera after you finish the cold treatment. Then you can rub with aloe vera and keep putting it on. Put it on 4, 5, 6 times a day. Just rub a little more aloe vera. Maxine.
2 experiences.
Yes.
My nephew came to visit me here when he was 3.5, and he was so excited when a motorbike came up to the apartment. With his bare feet, he ran and stepped on the muffler. Now that little boy screamed for hours. I didn't have any ice. I simply ran his foot under the cold water for an hour. He cried himself to sleep. But the next morning, he was running around as if nothing had happened. Just 1 hour with the muffler. And then last summer, I was home in England. One of my students from China called, messaged, said, "I just poured hot water over my foot. What shall I do?" Cool water, aloe vera. They only had like this, they didn't have fresh aloe vera, but they had like the aloe vera from the cosmetics store, something with aloe vera in. And I put it on, and she barely has a scar. I said, "You're not going to lose a husband because they can't even find the scar." I mean, just cold water and aloe vera, and then she's got a slight scar on her foot. It's amazing. God's simple ways.
Yes. It really limits tissue damage.
On the bottom of the iron once, so I was touching it to see if it was on or not, and it was, and I didn't know it was. It's right the whole palm here, you know.
Yeah.
And so quickly I got ice, and I was going shopping, so I just carried the ice with me. And I went and stopped at another place, when it melted, and I got some more ice, you know, and I just kept it on for all afternoon, and it never blistered at all. It could have easily been a horrible problem.
So you initially put 2-4 hours on the
2 to 4 hours.
Until it stops hurting.
Yeah.
That's the key.
Now
And if you take it off for 15 minutes and it's still hurting, put it back on.
the therapist that taught us this, we had a class in physical therapy school that was industrial therapy, and he had patients. He worked at Kaiser Steel Mill, and that's 2,000 degrees. So he would get patients that would get splattered molten metal on them, and that's a terrible burn. One of them, he said, it splashed and it went down into his boot. So he's got to unlace his boot, quickly pull it out, so that burned pretty deep. But he said he never takes his patients to the hospital. He always treats them first at the steel mill, treats them with the ice, and then they can go to the hospital. tomorrow. He said he did on that one more than 12 hours. I think that patient was 24 hours he kept with a cold pack or insulated cold pack. That would have been a very deep burn otherwise. There was another patient that a neighbor, I was passing by this store, and the guy had a little market, and then he had a little shop where he worked on cars. It was cold in the winter, so he had his scrap wood in a barrel, and he had a fire going to keep his garage warm. And it was just on the edge of his garage. It was kind of a little open air. And he's working on a carburetor. So he's looking in there and he's doing this and that. And, you know, some of the gas vapors got over close enough that it ignited the vapors, and his face was right there looking at the carburetor, and poof, it just exploded in his face. So when I got there, just seconds after that happened, he goes, "I got to go to the hospital, quick! Grab this and that." And I said, "Wait a minute, don't go." And he had his face was kind of brown, and you could see singed, and you could see where he had squinted. There's that little white lines where it was still white, but most of his face was brown. So I said, "I'll tell you what." I said, "I've been dealing with this for years. If you will just get some ice cubes, put it in a double plastic bag, put it in a pillowcase, and put it on your face for about 3 or 4 hours, you'll have hardly any tissue damage, and you'll be fine." He goes, "Are you sure?" I mean, he was sure he was going to have his whole face would be, peeling and this and that. I went by to see him the next day. He said, "Thank you so much. God must have sent you at the right time." Because I've never visited that store ever before that. I forget what I wanted to stop for. And then he was right there. He said, "Oh man, I just burned my face." And so he did that. The next day he had just a little bit of light pinkness, and you could hardly see where it had been burned. And he was so thankful. So anyway, use the cold treatments. They're amazing. Don't be afraid of ice, but just don't do it too cold too long. That's the thing. So you get a little frostbite. You want it insulated. You don't want straight ice on it for more than 20 minutes of the ice massage.
So when you said insulated cold earlier, you were talking about not just keeping the ice from melting, but insulating the skin.
From the skin, yes. So like for a burn, you want it to be. You're not rubbing it, no.
You need something between the ice.
Yes. So you have a double plastic bag that kind of helps when it melts, that it's not dripping all over the place, and then it insulates a little bit more of the extra plastic bag, plus inside of either a t-shirt or a pillowcase. So it's thin, but it's enough to help insulate. It's still getting cold, but it's not going to give you frostbite. Okay? All right. Any more questions about that?
The girl from Sri Lanka that had the electronic, she had an electrical burn.
I don't remember that one.
Do you remember that movie man that he touched the one, the trolley or something, and he made me soak the ice for him, so big. It takes almost 8 hours for him to soak until no pain. Oh. He ordered that until no pain. When
Yeah.
we take it out, we remember when
Yeah.
we first
Yeah, very good.
the health center. It was so big.
Jasmine was like that. If I remember right, she had to leave her hand. She got electrocuted with a lightning strike. She was near an outlet in her room, and her hand was very burned, very bad. And so she kept it in a bucket of ice for if I remember right, it was like almost 24 hours or something, in and out, But she didn't have any ill effects. It was a long time because it was a bad.
Yeah.
So you're saying for burns, you want to put some kind of a sheet over the burn first, and
Over the ice. You have wrap the ice and the double bag. You wrap that. I just put it inside of a pillowcase is easiest, and then it's contained, and you can take it off and put it back on. You don't have a lot of fuss with layers of things.
But if you don't have anything else, just use plain ice and water for a while.
Or cold water. Just keep if you can run cold water. Just keep running it, and just leave that one on the floor is fine. So it won't stay there very long.
Yeah, that's going to pull it off.
Okay.
The initial part that you really got to use the ice on until it stops hurting.
So the sooner the better you get it cold.
Yes, immediate. If you wait 20 or 30 minutes, it's already swollen quite a bit. So the quicker you get it into something cool, even if it's just river water, and don't worry about an infection. If all you have is muddy river water, get in that muddy river water. You can rinse it off later. You can clean it with betadine or whatever you, soap and water, clean water. But if all you have is something yucky, it won't hurt it. You need to cool it down. Even mud, if you want to put some cold, wet mud, if that's all you've got, put it on it.
So you're not worried about infection?
You know, you're not going to get an infection till the first layer of skin peels. If it blisters and then it's broken, that's when you get some infection inside. Those little blisters are insulated. For me, I like to...
But the effect would be worse to
not treat it. That's right. Usually it won't even blister. Yeah, usually it won't even blister if you do it properly, or very little. Okay?
So
Good.
you mentioned
nice enough.
aloe vera.
Yes.
Is there any benefit to using something like lavender oil?
That one I don't know. So if you know about lavender oil, how that works,
It works well.
good.
So it's like
For burns.
Lavender oil, if you put it on, it has a similar effect to cold. It seems to me, because if you put it right on immediately, you don't get blistering, you don't get deeper stuff.
Good.
My guess is that ice is probably better,
Yeah.
but
when you
if,
finish off.
yeah, when you finish with the water or ice, I would say put lavender oil in if you have it.
Yeah.
Because
Good.
it's a very strong anti-inflammatory.
Good. Thank you for sharing that. So lavender oil helps also for burns. Okay. Now I want to talk a little bit about just regular massage and stretching. If you have a muscle that's aching, a lot of people have stiff neck muscles, trapezius and neck muscles. Again, if you will do some deep massage, some stretching, and cross friction works pretty good. Just so like these muscles are going up and down here, if you would just massage going back and forth, that helps quite a bit. Actually, let's go back to the ice cube for just a minute, because we won't have ice later. Let's go back and we'll talk about migraine headaches. We'll talk about other headaches later. Yeah, we've got a little ice here still left, so that's all right.
This one's not been used at all.
Yeah. So what I want to show you with the ice cube is that if you have a migraine headache, you have one area of the brain, let's say it's on this side, that has a vascular spasm in it. And the doctors will, one of the things that they'll do for you is to give you caffeine medication that's a real high dose of caffeine to constrict the blood vessels, and then after 3 hours it dilates the blood vessels and that muscle spasm goes away. So I got to thinking, at least that was my thinking about why that would work. And somebody else said, you know, eating ice cream sometimes helps. And I said, that's pretty weird, isn't it? But the reason is that when it's really cold and you're eating it, it constricts the carotid artery, and then after it warms up, then it restores circulation to that part of the brain. So as I thought about it some more, I thought, you know, I bet if I would use an ice cube on the carotid artery right here, I could help a migraine or any kind of headache, but especially a migraine. So what I started doing, and I practice on people, friends that had a migraine, and then I started, when it worked out, then I started on patients that had migraines. And so the carotid artery is right here where you can feel your pulse. You just put your fingers right next to your Adam's or your Eve's apple. Ladies, you have Eve's apple. It's stuck there. And then you just simply, again, hold the towel under it, and do 10 seconds. And you'll get a brain freeze from 10 seconds, just real softly. You don't want to massage it hard. There's a reflex that goes to your heart that slows your heart rate down. Okay, now I'm starting to get a neck freeze and a little bit of a brain freeze after about 10 or 12 seconds. Brain freeze. You remember when you ate a smoothie too fast? Your brain kind of starts feeling funny, and then so you kind of affects your breathing a little bit too, and then that's better. I'm okay now. So you quit eating that smoothie or ice, smoothie, whatever it is, and then the circulation returns to your brain. You almost feel like you're about to faint. So I wait 1 minute in between, and then I'll do it again, another 10 seconds. And then I'll wait a minute and do it one more time. So I've done it 3 cycles. 10 seconds, not 1 minute, not 10 minutes, 10 seconds with the ice, just 10 seconds. Count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 8, 1,000, 9, 1,000, 10, 1,000, and then it starts to feel numb again. And that is constricting the blood vessel. That takes caffeine to take effect, takes about 10 or 15 minutes to constrict, and then it takes 3 hours for your body to clean the caffeine out so that blood vessel can now start to dilate again. But the spasm goes away. It's like what we do in therapy. We do a treatment called contract relax. When a muscle spasm in the neck, we will push against it and then relax it. And we can stretch it a little bit more, and we can push against it and then stretch it a little bit more. But it's contracting and then relaxing. And each time you relax, it seems to let go a little bit more. This one does the same thing to the blood vessels. It's constricting and then it's dilating. 3 times is usually enough to get rid of at least 50% of that migraine headache. If it doesn't go away totally, in about 15-20 minutes, do the same treatment over again. You can do it 3 or 4 or 5 times until it goes away. Just give the patient the ice cube and say, 20 minutes from now, do that again. 10 seconds, 1 minute off, 10 seconds, 1 minute off, 10 seconds, 1 minute off. And most headaches go away. Now for a regular, like a tension headache, this could help that some. It'll increase the circulation, but often there's tension in the muscles in the back of the neck. So you could use the ice massage, stretching those muscles forward, stretch them forward, do it again. And then after you do that, maybe 10 minutes, then just do some deep massage to those muscles and just get the muscles to relax and to feel better. Sometimes a headache will come from a misaligned vertebrae. So it's good if you have any stiffness turning your head side to side, it may be to do with that, or sideways, side bending. Then you might need to see a therapist or a chiropractor and have them realign that. We'll talk about in the afternoon, we'll talk about some ways of helping to try and realign it as a layman. But I would recommend that you don't do too much pulling, traction, and snap like the chiropractors do. But we have some simple treatments that I'll show you later on that will be a gentle way to help that to realign. But there's, again, for headaches, that's another cause. A lot of times it'll be the very first vertebrae that's right up next to your brain. And there's several ways that we can get that to realign. So I'll show you that later on. But most of the time, just neck massage, and once in a while, if you can, a lot of times, if somebody's had a headache for quite some time, they'll have a real thickness on the back of the occiput area right here. So if you can feel your occiput area right now, you should be able to tap it and just feel the bone. If you massage it and you feel it's kind of thick, then you have a chronic headache type thing or chronic tension in that area. You should be able to tap or feel it and feel the bone, only with thin skin separating you from that. There's a muscle there, but it's very thin, And if you've got chronic headaches, it'll be sometimes maybe even half an inch or at least a quarter of an inch thick. And when you press on it, you can leave indentations from your fingerprint. Also in the forehead, if you have chronic headaches, if you push on your forehead and you massage it just a little bit, and then you feel do you have little indentations? Is there some thickness there?
Like edema.
Edema? Then that is also a sign of chronic headaches. I had one Korean lady that was very pretty come to the health center here years ago, and she had bad headaches, and so I was doing some frontal massage in there, and then after I finished, she went into the bathroom and she said, "You left fingerprints all over my forehead." And she just had a very thickened forehead. It was a chronic headache that she had. And I said, "It'll go away, don't worry." She said, "It better. My husband will divorce me if I don't look beautiful." She was a very fashionable, very pretty girl, but her husband was wealthy, and she said, "He'll find somebody else that doesn't have dents in her forehead, you know." But it went away in 20, 30 minutes, you know. That skin deep, that's how much some people love their spouses, you know. If you're not absolutely gorgeous, you know, I'm gonna find another one, Mike.
Her fear of the husband's attitude was causing her to have
It might have done that too, definitely.
That's a big stress.
Yeah. Thank you for sharing that. That's quite likely. So anyway, her hot foot bath would be very helpful also. The feet have lots of little reflexes in them, and it goes to all different parts of your body. In PT school years ago, if you look at the old hydrotherapy books, it's got an acronym BULB. B-U-L-B. Hot foot bath affects the brain, the lungs, the uterus, and the bladder. So bulb. B-U. I'm sorry. Uterus was first. Yeah, blood. The brain, uterus, lungs, bladder, and the lungs. Anyway, we got bulb there. So anyway, if you were to soak your feet in hot water, there are probably 50 or 100 different areas of your body that are affected. Wow. Agatha Thrash said if she had one hydrotherapy treatment to do on a patient, no matter what their disease was, she said, I would do a hot foot bath. Wow. So try and remember that for pelvic congestion, for menstrual cramps, for lung congestion, for coming down with a cold, for a headache, sinus infection. It affects all kinds of areas because the reflexes in your feet, we just haven't tested them all, but it affects all those areas. Maxine?
Just this weekend, I consulted with a young man who has GERD. Yeah. He doesn't think it's severe, but it's very severe. When he drinks water, he gets uncomfortable. And so I'm thinking maybe try the hot bath.
Yeah.
I told him other things to do, but I'll try the hot bath.
And then spacing his meals out.
I put him down to 2 meals a day.
2 meals a day and no snacking in between.
And
that's so helpful.
He spent the day supping on cabbage juice. I said, now every sup you take aggravates it. You use it in the morning, drink your cabbage juice, and then the only thing you're taking during the day. So I had to work with him a little bit.
Yeah.
He said, I'm very active. I said, yes, you've probably been having sports and eating your food too soon, and so your lifestyle is now caught up with you. And so I went to Eugene Pine's consultation sheets and tried to address everything with him. And so yesterday he said water was still bothering him. He said, just take little sups of water. You need to get your water in. And of course he's lost a lot of weight. I said, don't be anxious about your weight because now that's going to be another problem later on. So I think I'm going to add hot bath.
Yeah, good. One other thing, like I mentioned for menstrual cramping, a lot of times there will be warmth to the stomach area. That helps some people, but it also causes congestion. It's already got too much blood congestion, but if you put ice on that area, it can cause some muscle cramping too. So if you did the hot foot bath, it just relaxes. It'll pull the blood away from that area, restore good circulation, and again, the cool bath or some bathtub where you don't get into a swimming pool if you're having a menstrual cycle, but the cool water will give a tonic for the whole body and help them to get over it. Also for headaches.
On the menstruation?
Yeah.
To be more effective, not just the foot bath, because I did that for years, it didn't work. When you get hot water as high up as you possibly can.
Right up to the knee if you
Right
can.
up to the knee if you can. So a hot basin, a hot bucket.
Yeah.
Hot bucket, yeah. For menstruation. And I just collected data on that here with students last year. And one of the girls said, what do you usually do? She said, I usually cry. It doesn't help much, but I cry. And so she came to me, and within hot water, within a minute and a half, she was going, no, I'm not coming out. I'm afraid it's going to come back. So she stayed in that hot water for like 15 minutes. And, seriously, you're going to be okay. You're going to be okay. And there's carryover for like 1 or 2 months before she needs the hot foot bath again.
Very good.
No, for me, it took me like 20, 25 minutes for me to get that release. For her, 1.5 minutes, the pain was gone, but she was just so fearful. She's like, I'm not coming out of this hot water right now.
That's good.
Keep it hot.
So why up to the knees?
Well, I don't know, because when I came to the health center, I started to do the hot foot bath. I had severe dysmenorrhea. The hot foot bath didn't work for me. But when I went to Korea, I had like 6 months left on my cycle. And I did up to my knees, like, oh, this works. So I did 30 years of no pain management up to my knees. Again, and that there was carryover.
Very good.
So for the whole cycle and for maybe the next cycle and a bit of another, there's carryover from the hot with the water up to your knee as high as possible.
As hot as possible.
As high as possible and as hot as possible.
Yeah.
So that would be about 110 degrees to 115 degrees at the most. You don't want to burn your skin. Your skin's sensitive, and there's certain charts that you can find that show how much temperature is allowable. For 1 second, 170 degrees, 2 seconds, 150 degrees. There's different charts you can find, and we can find that, and you can take a picture of that later on. And that's how we do fomentations too, is we can do it the brief times.
Okay, and
Yes.
on the other side, I had a girl who hadn't been menstruating. So she came to me and I did a sitz bath for her. And she was right.
That was not.
She hadn't been menstruating yet, so we did the sitz bath.
Again, it stimulates the hormones to be normal. If she had gone swimming in a cold pool, it might have helped her also.
Just
a hot sitz bath.
Hot sitz bath.
Just hot sitz.
Yeah. Mike?
We're talking about this therapy that you learned about, acronym GOAL.
Yeah.
And it can affect the lungs.
The lungs, yeah.
So if someone were to get a flu, whether it's the one that's alert is about now, or something,
Yeah.
how would that help the lungs just to be able to fight the infection?
Sure.
Okay.
It'll increase circulation to the lungs, relax, so you breathe more deeply. Somebody that's having difficulty breathing, it'll just dilate and relax them and increase circulation, so it can relieve that congestion.
One of the things I was looking at about this coronavirus is it says if it goes into pulmonary edema, not to do any hot fomentations on the chest.
On the chest.
Yeah, the chest, because it's already.
It'll be okay.
It's all swollen.
Because it becomes pulmonary edema and it just really can make it a lot worse if you do
So you
fomentations.
did ice massage, no?
Nice.
That could help. I'm thinking with pulmonary edema, it's probably more from heart problems with that situation than from just like a cold or a pneumonia. I've always seen with my patients that have pneumonia or some congestion that the heat to the chest really seems to help them. And they'll say, why didn't somebody prescribe that earlier? You know, I feel so much better. It relieved that tightness in my lungs.
So Brenda, when you finish the sitz bath, just a cool shower afterwards.
For me, right before we were ready to travel this time, I was coming down with something. I was like, oh, I gotta get rid of this. So I just quickly did a real hot foot bath. I boiled water, put it in the kettle, put it right beside me, put it as hot as I can tolerate it. Do it for at least 20 minutes and keep adding a little bit of hot water from the boiling kettle. So So then that makes it as hot as you can take it, and then finish with ice water at the end and lay down. But the other important thing is after a hot foot bath is to rest at least 15 minutes and stay warm. And I'm warded off that thing.
And didn't pass it on to anybody else. So that's, you know, not only are you treating yourself, but you're treating 50 other people around you that would have caught it. You know, every time you sneeze, it's sharing in the atmosphere millions of little viral particles that can get around. So.
And it's easier than getting a hot and cold bath or shower, rather, I think.
Yeah.
And it's just as effective.
In a hot and cold shower, a lot of times your feet don't end up getting much warmer anyway. So you want to, this helps really get your feet nice and warm. And be sure you rest, and even half an hour to an hour afterwards. It's really helpful. Yeah, you'll sleep really nicely after doing that. Maxine?
Michael Welsh, for his thesis, he did a study on what happens during that resting. And they took blood before you rest and then took blood after. And it's like 40 in multiples. Your white blood cells increase in multiples in the resting. It's in the resting that the white, and I'm trying to remember the numbers, but it's in the resting that the white blood cells increase. He did his thesis. And of course, it's at Stanford University, so he had all the lab folk and everything, so they took the blood before and after, and it's in the resting that the
Now,
white blood cells.
if they didn't rest, did they test them without resting also?
I can't remember, it's a while ago since I looked at
Yeah.
it, but it's definitely
Because partly what happens with the heat treatments, the fever treatments, is that your blood vessels, you have a blood vessel and you've got red blood cells that are passing through, but you've got white blood cells that are sticking around the edges of the blood vessel, and there is a few of them that are circulating, but most of them are just sitting on the edges. And it's when you get a fever that the body says, we need to put them all into action. So these guys start breaking loose, and then they're all into action then after that. So the more you do that kind of a fever treatment, the quicker your body starts fighting the virus or bacteria, whatever it is. So, yeah,
And a hot foot bath too, the same.
hot foot bath circulates them. Steam bath, the burrito wrap that we're going to show you, you know, just lots of different things. Whatever you can do to get the temperature up, the body says, there's a war going on here, and we need to get all those soldiers that are available busy. It's like this National Guard, they're at home most of the time. But when there's some riots or there's some war going on someplace, they start calling them from home. Even if they're not in shape, they still have to go to work. And so that's how the wars are won. So we've got to get all the troops going. Don't let the white blood cells just sit there and sleep. Okay? One other thing with, we were talking about a sitz bath. I had one patient one time that I was staying with for 1 month, and he had a problem. He was an older fellow. He had a problem of urinary incontinence, and his wife was constantly fussing about that. He'd get up in the night to go to the bathroom, and on his way in he'd trickle all the way to the bathroom, you know. And part of it was her problem, is because she said, Billy, now don't you wet on the floor again. And as soon as she'd say that, he'd start wetting on the floor. So when I took care of him, she had gone away to Arizona for a month, and I was taking care of him. I didn't scare him in the middle of the night and say, Billy, don't, you know, I just say, let me help you to the restroom, you know, and so I'd take him in there. But one thing that really helped him, I bought 2 turkey basting pans, little tin basting pans that are about 6 inches deep, and I put it in the bathtub, and I filled one with hot water and one with cold water and tossed a little ice in it, And I helped him sit down. I mean, I had to help him get in there and out of there, but I helped him sit in there for 3 minutes in the hot, and then I'd pull him up, and then we'd step over, and then I'd put him in the cold for a minute, and then I'd pull him up, and we'd go back to the hot. And we did back and forth 3 times. We did that. No, this was a while back. And then we did it 2 days in a row, and he never had another problem with any incontinence during that time. It was amazing. So I tell my patients, you know, we don't have a sitz bath sometimes that they can use in a nursing home. So I tell them, men or women, either one, I say, get a glass of ice water and just pour over yourself in your private area and see if that doesn't help. Because part of the problem is we've got these little tiny muscles that get lazy after time, and they need strengthening. Doing Kegel exercises, you're strengthening those. You do pelvic tightening, relax, pelvic tightening. That's strengthening that muscle. Well, the cold water does the same thing, maybe even a little more severely. But anyway, it worked great for this gentleman. So just another little quick thing with that.
So was that hydrotherapy for him? Was that affecting an infection or something, or what?
No, just muscle. He was 85 years old, and the muscles had just lost tone over time. Wow. And this restored the tone back to those muscles. Very, very helpful, and it's getting the anal tone too at the same time. So, you know, you have stronger muscles. Those are amazing muscles. They're small little muscles, but very important for us. If we did not have those, we'd all be incontinent all the time. So it's, you know, God invented those 2 muscles, front and back, to keep us clean.
Yes.
All of our lives till we get to be. We're either babies or old people. Yeah. But an older person has some help there. Okay, let's take another little break for a few minutes.
So, do you think they'll probably have erectile dysfunction?
Rectile?
Erectile dysfunction.
Probably. Yeah, there's one other thing that I read in Agatha Thrash's book for erectile dysfunction. She said a cold bath can also help that. So again, stimulating the hormones any way you can to get them a balance of testosterone or estrogens to increase those hormones. That's important. Exercise is helpful for that also. Okay, let's take a little break now.